All right, so isometrics are really good for tendinitis. And so I want to show you, that's why I was pointing my knee, we're going to do it for patellar tendinitis today. And the idea behind an isometric is you sort of wear out the portion of the tendon that is the healthiest to bring some tension into the part of the tendon that is injured or is least healthy to help that tendon basically proliferate and heal. Okay, that's very layman simple terms for it. And so in order to do that, in order to wear out the healthy portion of the tissue, you have to do basically a prolonged isometric, not too long, followed by a rest period. So I want to show you a little bit of a progression that you can do for this, and starting with this first one that I'm going to show you, and then it'll get increasingly harder to do. So this is what I'm going to show you is sort of what you would do if you were at the gym and had a leg extension machine, right, with the bar across your, that sort of thing. But most people don't have that at home, so I always like to show you things that you can just do at home. I'm using a workout bench, but you could obviously probably use like a chair or a table, like a coffee table. Make sure it's heavy enough because you don't have to put a ton of pressure through this, okay? And so what you want to do, the little protocol for this is you want to make sure that you don't move it though. You're going to basically bring your foot up, and you want to have a knee bend about 20, 30 degrees there. And you're going to bring your knee up into this object, whatever it is, and over about 3 seconds, you're going to apply the pressure. So it should be sort of like build into the pressure. So it should be like 1, 2, 3. Now I've reached the tension that I would like to have, and I'm going to hold this for 30 seconds. The amount of force that you should put through this, I'm not trying to squeeze as hard as I can. It's okay if you have a little bit of pain in the tendon or the area that that you're working on, about a 2 out of 10, okay? A little bit of pain isn't too bad. And again, I'm just trying to build up to that point where I feel just a little bit of tension there. Not a ton, not as hard as I can, but I'm definitely pressing, and you're going to do that for 30 seconds, okay? So after 30 seconds, you're going to relax, bring the leg down, and then the rest time on this, which I think the rest time is actually the hardest part, is 2 minutes, okay? That's sort of what research shows is this 30 seconds on, 2 minutes off protocol. Now, obviously, if you're doing both legs, right, you can kind of switch back and forth, and that delays the amount of time that you're doing the rest time because you're working on the other leg. So, but that's the first one, is it build into that, hold it, 30 seconds on, 2 minutes off, and you're going to do that for 4 rounds so that you would get a total of 2 minutes tension through the patellar tendon, okay? So that's the first one. That's the easiest one. This is where I would start with most people, and just to get some tension through there, because the other ones become much harder. All right. Now, the second one that you can do is basically what we call a wall slide, or, this is the thing they used to torture us in gym class, where you kind of make the chair, right? Well, this one we're doing a little bit different. We want the knees to go forward to put maximum amount of tension through that patellar tendon. So to do that, you're going to elevate your heels a little bit, slide down, and then hold this position, okay? Now, the harder these get, the harder it is to hold for 30 seconds. So if you have to build up to 30 seconds, that's fine, but you at least need to do 10 seconds, okay? So in this position and just holding it there, same protocol is as the other one, where you're gonna try to build to doing 30 seconds on, 2 minutes rest, 4 rounds. After you get pretty strong at doing that, you're going to move to a single leg, okay? So a single leg is more same thing, heel elevated, coming forward, putting right through there, trying to get nice and straight, not tilting to the side too much, just in that position. You're going to feel quite a bit of tension through the patellar tendon with this one, okay? So this one you would have to build up. I would have to build up to this one. That's like, that's a lot of pressure, okay? So again, at least 10 seconds, same protocol, trying to build up to 30 seconds, then 2 minutes rest, 4 rounds, okay? Now, the last one I want to show you, this is one I tend to do for people if they're having some knee pain, they have a hard time tolerating that, but they're kind of stronger than that. For a lot of my runners, this kind of actually gets a lot of tension throughout the whole body. It's an isometric where you can feel it in your quads, your patellar tendon, even your Achilles a little bit. And so I like to use this super sophisticated paper cup, okay? And what you're gonna do is you're gonna put that paper cup on the ground. And the idea is this paper cup's not too stable, so you can't put weight through it. And you're actually gonna get into a long kind of lunge form. So it's gonna look like this. It's gonna be here. I push my knee out over my toe. I bring my knee all the way down to that cup. And then I wanna, whoop, almost crushed it. And then you wanna hold there. So the idea is the cup is that make sure that you stay low enough, but that you don't rest on the cup, okay? So you need to make sure your knee is touching the cup, because if you come up higher, you're gonna lose a little bit of the benefit of the exercise. That one's also really good for quad tendonitis because you feel it a lot in your quad, not just the patellar tendon, okay? So that's sort of the bonus one. Again, same protocol, 30 seconds on, 2 minutes rest, 4 rounds. So if you're dealing with any sort of knee pain, especially knee pain that's more here in the patellar tendon, a lot of times this is called jumper's knee. If you've been to a doctor, they will call it patellar tendonitis, and you're feeling pain going up and down some stairs and things like that, maybe after a workout or a run, give these a try, especially if it's a chronic condition. This will definitely help you. If you have any questions, please put your questions in the comments and just like and subscribe our videos, and I'll talk to you again soon.